out of tooting my own horn. But in terms of calling then, it's all through Good Medicine. You don't have to book through Good Medicine. The 833 number, we have operators there. But for that first patient, they do ask for the referral to be placed by someone with medical, so a nurse, someone in that office.
Okay, so what you're saying is that you can't do it directly.
You cannot do the initial consult. You can call them and say, hey, I want in, but you would need Allison to then send over a referral.
That's for the first one. What happens
After that, you just book with us directly.
for a separate issue? Like even if it's a new issue, then you do it on your own?
Yep.
Oh, okay.
You can just call us. When I pick my follow-up, so say I saw a patient with pneumonia, you're doing well, my rule is, hey, I'm going to see you in 2 weeks, or whatever I feel at that point. But I always tell patients, it's just like your doctor's office. You're not feeling well, please call me. But it works the other way too. You're feeling great, you don't need me, I just go away. So it's really about what your needs are and how we can help. It's not about what we need to see.
Does the coverage include Medicare Advantage plans?
I will say that is probably per Medicare Advantage because there was the Scripps Medicare Advantage, and that obviously went away. So I will say I know there's some Medicare Advantage, but I couldn't tell you beyond that. But there is a lovely biller at the office that can answer those. But when Scripps Medicare Advantage, 100%, all of those. Okay, much. Okay.
I think you mentioned that some Good Medicine physicians are also the primary care physician. Does that happen typically or just occasionally, or how does that happen?
I don't know. There's one lady sitting next to you that might have a primary care. That's a Good Medicine physician, but it is atypical. I will tell you, when they first started this program, they were a little unsure as to what would happen. Would we have 5 patients, or would it be now 19,000? So at first they went out, and when it was a program, they went out and offered. They were like, hey, anyone need this? And so some patients ended up with me at that time, maybe with you. And then when it really took off, they said, okay, well, we're not going to provide chronic so much anymore. You can keep what you have and go with that. But if a patient truly is homebound, feel free to keep them on your panel. So nowadays, what I take on are, like I said, ALS, MS, stiff person syndrome, any of those things that truly make people homebound. So I'm a little more chronic for those now, not so much for the healthy people.
I'm still somewhat confused. Thank goodness I haven't been sick very often. Okay, when I have needed medical care, I've either gone to urgent care or to the emergency room. And my bet is that most people here, when they have an immediate problem, wind up in the emergency room. Is there any way of transitioning to home-based care and skipping the emergency room? What would be the steps necessary?
The steps necessary would be you're not so sick that we should wait at all. So if you're very sick, then by all means, ER. Because again, what we're going to have to still wait for at our disposal is, while we can get lab out there, it's not 2 minutes after I called them, x-ray, etc. That is a little delay. But say you're feeling ill. That's better for you. So say you're feeling ill but not critically ill where you do need something immediate, then it would be, hey, can you guys go out and see him? And like I said, we can have as little as a day turnaround for that. But if you are really feeling ill, you are emergent, I can't breathe, I'm having chest pain, I'm having the worst headache of my life, I'm having stroke symptoms, ER is the way to go. So that's where I would say transitioning to us would be, I'm feeling maybe a little more urgent care, not immediate, but within the next day or two, I think I'd probably need to see a physician. That's where we'd be the better option. Other questions?
Oh, here we go.
I have a question. So for a La Costa Glen resident who goes to Scripps, is admitted to the hospital, discharge plan, coming back to La Costa Glen, is everyone going to get that documentation on their discharge paperwork with a referral, and that Good Medicine will be seeing them in the next 3 to 5 days?
Sure. So the Encinitas is pretty good at it. However, you can always say, hey, can I make sure to have a Good Medicine physician follow me upon discharge? But the majority of our physicians work at Encinitas, so they're very familiar placing that referral. Look, La Jolla gives us some as well, but a little less familiar, and then they'll reach out. So you're always free to ask for that. That's where the referral can come from then, and you don't need a separate referral through Allison. That will be put on the paperwork. Hey, this doctor, we're going to reach out to you at this number. Sometimes they book the appointment even before you leave the hospital and for your follow-up. So if you're hospitalized, the referral comes directly from the hospital. You don't need to have to wait for Allison to send anything. That's already taken care of.
Just a comment. I've been listening to you, and I just thank you, and I thank Scripps so much for tying in Allison. We have speakers sometimes that come, and they're not really familiar that we're at La Costa Glen, and it makes it so much easier. We thank you that just call Allison, then we have to look up numbers, we don't know what to do, and thank you for tying that in. It makes it much more personal to La Costa Glen for us.
Well, you're welcome, and she helps me a lot. When I need anything outpatient, I go, well, I want this. Can you guys do it for me? Is that a possibility? So I know at this facility you have a lot of options. You have a lot of resources that she can provide, and we can try and get things done.
And I also need to give a shout out to May and Lacey back there. We also have Melissa and Kay. Believe me, this is not my show. We have a great team, so thanks to everybody.
Could I ask about insurances? Does it matter what type of health insurance you have? Like maybe you're not under Scripps clinic or whatever. Yeah, that's what I mean.
I will say Medicare, we're pretty good all the way across the board. Anything else, the office has all those answers, but anything Medicare, pretty good across the board. Mm-hmm. The Advantage is a little different. There are some on there I'll see. I'll let you in on a secret. When you go to med school, you learn zero about insurance, and I will say that mine went slightly above zero, so I kind of vaguely look at it. But having been an ICU doc for my first 15 years of my career, I don't think I looked at one until I started doing home visits. So we have a very competent billing person that will say yes, no, or we can get prior auth. But they're very good about looking at that. You got it. I got one in the next week.
Do you order the tests like lab tests, MRIs? Do the results go to the primary care physician? And normally, is it possible that a primary care physician would not want you to go to home-based care?
There are, I think, at this point, very few primaries. I will admit, in the beginning, primaries went, you're going to take my patient. Mm-hmm. We said that's not our goal. Our goal is really to get them healthy enough to go back to you. That quickly went away when COVID hit. So I can't say there are a few concierge physicians we just don't see because you're already paying for a service. So why use us? So it's not that we refuse to see him. There's one concierge doctor that actually says, oh, if he's not going to be available, he does still have us. But for the most part, no primary. Does it have to be from Scripps? No. Now, all that lab work, everything we order, does go in your Scripps portal. So if your doctor is a Scripps doc, they'll see it immediately. If not, we do fax over everything. And I know HIPAA compliant, fax is the only way that is HIPAA compliant if you're outside a computer system. So not the fastest way, but we can fax. If something's critical going on, I pick up the phone and call your doctor. So we do try and communicate because our whole goal is to keep them in the loop. You've been with them, you trust them.
Do they ever, you order the medications prescribed. Now, if the primary care doctor doesn't agree with that, does that happen?
Usually I phone, rare, and I inform them, hey, we were looking at, here's my reason for thinking maybe a change. If I'm worried that it's a newer medication and I'm going to be transitioning eventually this patient back to them, I discuss it with them. Hey, I was thinking about, and I had one the other day. There was a new gentleman, I wanted to start something, and I said, I'm considering starting this. I know you've been following. I didn't know if there was a reason you hadn't thought about this med yet. And we have that conversation. Because again, I'm likely not going to be your primary. That's a very small percentage of my patients. So I want to check in. We want to do things to continue this care. So we really do try and communicate with your doc, and I would call docs 5-6 times a day. So I really do try, and if you're doing great, I send them a little chart note, but if you're really complex, we do pick up the phone and call, just like in the hospital. We were all trained in the hospital, so a lot of times we're calling already when we're in there.
I just want to mention again on the concierge physicians, because we do have many residents, who have concierge physicians. And it may be that when a person is released from the hospital, it's expected they will have regular contact with their concierge physician. So they may not be eligible for good medicine. Is that correct?
I will say you're eligible, but oftentimes, again, if you have a concierge, we go, well, if they can get you in right away. But we have a list at the office of people who have concierge. And like I said, there's one concierge physician that I'll call and say, hey, your patient is really sick. Are you going to get to see them in the next day or two when I'm discharging you? If not, do you want me to see them? And then I'll hand them back to you. And he's very open to that. So we really, again, from the hospital side, if you have a concierge, we're trying to call you and call that concierge physician, because we go, that's our best handoff. And there are a couple, I don't know if any of them, the ones that come here, but a few concierge that don't have hospital privileges, but they'll stop by and social see you at the hospital. And we go, okay, great, I'll loop you in. So we try and keep them informed. So it's not that you're ineligible, it's just you're already paying for a service. And typically when you're paying for concierge, you can get in really quickly. So that's not the issue. But I tried to get in to see my doctor. I was actually hospitalized at Scripps about a month and a half ago. And 8 weeks. Now, obviously, I got to pull a few strings and moved that up, but 8 weeks before I could see my primary. So, and he's a great primary, but, down to 3 days a week. So I didn't need good medicine, but it would have been a perfect time to have good medicine and say, hey, this is all wrapped up. So.
Do we have any other questions for Dr. McMurray? No. How about a round of applause? Thank you, Dr. McMurray.
Thank you. You're so welcome.
And please help yourself to snacks in the back of the room. And I just one more thing about Dr. McMurray. I think we're so fortunate to have physicians like her at Scripps. So she's here if you have any more questions. But thank you, everyone, for coming today. Hope you enjoyed it.